Welcome to Time for Healing. I'm your host, Marion Porter. Do we have a show for you? None other than Dr. A.J. Eckert. Yes, Dr. A.J. Eckert is going to talk to us all about gender-affirming medicine. Oh my God, you're on the show. It's finally happening. Look at you.
Yeah, we've been looking forward to this for a while.
I know. Welcome.
Thank you.
Yeah. So we got a whole hour and a lot of stuff to cover. I'm so excited. Now, gender affirming medicine. Could you explain to me what that is?
Sure. Gender affirming is kind of new language around LGBTQ plus healthcare, especially transgender healthcare. It's the idea that a person should be valued regardless of their age, regardless of where they are in their process, regardless of what their specific transition looks like. So instead of saying things like male to female, MTF, or female to male, FTM, the language has now evolved to more like gender affirming because we're not necessarily saying you're one thing and then you become another thing. And it also keeps in mind that there are other identities versus male and female. There's non-binary identities, there's genderqueer identities, there's over 100 different ways to express gender identities.
Wait, what?
Yeah.
Is that just a few? There's over 100?
There's the latest poll showed that especially among the younger generation and a lot of the millennials are primarily driving the increase in gender diversity and just talking about it earlier because we have such better role models now and positive things to look at, and there's YouTube videos and all of this. So yeah, and culturally too, there are different terms that are used. The intersectionality can't be ignored anymore, which we've been doing since.
What is that?
The idea that culture and race is also an important part of the LGBTQ movement. Intersectionality. So understanding that the movement was, in the beginning, primarily like Stonewall riots. That all was started because of a African-American trans female, but the kind of gay pride movement has been primarily co-opted by white men, cis men. So it's
wow. I so many questions. I don't know where to begin. My obvious question. I do want to get back to all the different genders, but cis men.
Right.
What is that?
Okay, so cis is essentially the same kind of term that we use as trans. So trans means differently aligned, and cis would mean essentially if you are cis, you are describing the fact that you were born with the body and the genitalia that aligns with who you think of yourself as a person. And when you're trans or non-binary, it's your body doesn't necessarily align what your brain believes that and tells you that you are.
Wow. And so there's 100 or so.
There's a lot of different ways. So part of my clinic is, understanding that also as a white non-binary person, I have limitations, and so just approaching it, understanding that there are things that I have to be empathetic and open to, but that I won't ever experience personally, like the fact that maybe even the term gay is viewed by some people as more white. And so it's not used in certain communities. And so research has largely ignored that fact, and we've been missing large scopes of the population that just use different words to identify as similar identities.
Gay doesn't just mean gay?
It really depends on how you're using it too. And I mean, in the very narrowest definition, gay is used for men loving men, but I know
not just
plenty
everybody?
I know plenty of females, I know plenty of non-binary people, I know a lot of people who identify that way. There are other cultures that believe that the term is very white, so they just use different language like same loving gender.
I like that, same loving gender, because all love is the same.
I mean, that's true. That's the core of it, really. And everything that I do at my center is because this is my family, this is my community. It's greatly underserved populations, and I don't understand how there isn't that equality yet, why we're not understanding in our society in this day and age that love is love is love, and that's all there is to it, really.
And so then gender is gender is gender. It's up for interpretation, individual interpretation then?
Certainly, and I mean, I would be more than happy to have a primary care clinic that isn't necessarily focused in on a certain population, but unfortunately we live in a world where we're still being very much oppressed and very marginalized and underserved. So my goal is really to create a safe kind of sanctuary type space where people can feel comfortable to actually go to the doctor and talk to their doctor about their sexuality, their gender, whatever they're doing in their lives, because the goal is to be as non-judgmental and open to all of that as possible.
So your clientele is LGBTQ, all the rest of that.
All the rest of that.
And so, but like a blood pressure is still a blood pressure,
Sure.
right? Like,
Sure.
So the difference comes in, this is my body and this is how I'm feeling type thing.
I think and I'm just going to use the term queer people, even I know that can be controversial as a term, but to me, it's an umbrella term for anybody who doesn't necessarily identify as cisgendered and heterosexual. So for queer people, sometimes it's just nice to have a space to be able to go and feel completely welcomed, and above that, to be seen, to feel like, okay, this doctor has these specific posters or these stickers or has gender neutral bathrooms, so I know that they care about my experience and they acknowledge my experience. Because a lot of it is in our day-to-day culture, we don't acknowledge or accept. I mean, just look at even the bathrooms here are male, female, and I always have a struggle in, okay, which one am I going to be safer going to here? And that's literally every time I go to the bathroom in a space that has designated male and female binaries.
Because there just isn't male and female anymore.
Right. Yeah. And I mean, not just anymore. It's been like that throughout history. It's just we are now in a place in society where we can start kind of bringing all those experiences forward. History is no longer being written by middle-aged white guys.
I love that. So it brings up an interesting, and I do want to get back to those hundreds of different ones because I'm fascinated.
I don't know all of them, by the way. I just know that's what the studies show.
Hundreds and probably growing.
Absolutely.
Well, I mean, as long as we're here, do you think that gender is individual to the person?
How so?
Well, like I always thought I was a lesbian, but it never always felt right for me to say I was a lesbian.
Yeah.
But it was like the closest thing that fit, so I went with it.
So I would say the way that expresses itself in my clinic with people from like your generation would be that I've had similar experiences with people who will say, I've identified as a butch lesbian, I've worn only masculine clothing, but then when the terms became more available about being transgender or non-binary, then they realize they're actually more aligned with that, and first one didn't really work. But it's all about language too, right? So for me, I legally changed my name 15 years ago or so, maybe a little less than that, but right around there. And we really didn't have terminology around being non-binary. Not so much. It wasn't out there the way it is now. And so for me, my justification was, well, I just want to be gender neutral. And gender neutral and not male and not female is something I felt since I was a kid.
Yeah.
But I didn't have good language around it until maybe a couple years ago.
Well, and that's kind of true for me in a way, because I never, I cannot wear women's clothing. My whole entire life. Women's clothing, I would put them on. It would make me itch. I would look at my body, I'm like, this is wrong. It would create such a cognitive dissonance in my brain. Even when I was a little girl, I would lose my mind, But I'm kind of happy being a woman. I kind of like the parts. But that always was in my head, I can't wear women's clothes. And lesbian, it just never felt right because, a girl gets a wandering eye and it makes you question. And a little hi, how are you? And it makes you question. And well, maybe this can't be. And so then it felt like when I was with a woman, I was feeling like I was a woman. When I would be with a man, I was feeling like I was more of a man. And I'm like, well, what is all of this? And I'm like, well, I just went with it. I said, well, maybe that's just me. It wasn't until probably, I don't know, maybe 3 or 4 years ago now, I learned about the whole twin spirit thing. And that felt true for me. But that's also co-opting a term, so I didn't feel right about going around and saying, well, hi, I'm twin spirit, how are you? So then all of a sudden everywhere there was trans language. And I'm like, I can wrap my head around this. I went with gender fluid, but that just felt kind of clunky to say. And then non-binary. And so I like that. But so can I be non-binary but not want to surgically modify my body and take hormones?
Absolutely. And really, we're talking about two different things here, too. We're talking about gender and sexuality or sexual preferences, which are also very separate things.
Yeah.
It's kind of like how in LGBT, the T, that's why sometimes people argue, well, that really shouldn't be part of it because being transgender isn't a sexual preference, it's a gender identity. So, even there it's combined like that in a way where they're very separate things.
Yeah.
But kind of back to that, I mean, that's why gender affirming medicine, so there is no one right or wrong way to transition, and there is no right or wrong prescribed path to do it anymore. The way it's different for everybody. So you can be non-binary and take hormones for a while or for your entire life. You can be non-binary and want to get top surgery. You could be non-binary and never do any kind of interventions. And the same goes for being transgender. It's all about what label you choose to apply yourself. And there are non-binary people who identify as transgender. There are non-binary people who do not identify with that label. It just kind of all depends. And there are transgender people who don't necessarily go through any procedures. And honestly, unless you are sexually interested in a transgender person, it's really none of anybody's business, what treatments and what procedures they've had. And I still hear language like, oh, have you had all the surgeries? And it's like, well, hang on, that's not a thing anymore.
It makes me think that, I'm not qualified enough to even use the language, but I'm certainly out of like the lesbian category.
Yeah. Right. I mean, I think.
And is that part of it? Like, there's no longer a need to really pigeonhole yourself. It's just how I am expressing and feeling validated in saying who and what I am.
Absolutely. I mean, I think that the pigeonholing at some point, what it does? It honestly just makes research into gender identities so much harder, because if everybody has their own box and label, we're all just human, and whatever label you choose for yourself, there's no reason for me as a doctor to go in and say, well, I don't believe you. I don't feel like that's actually your experience, And that's what doctors have been doing up to really around it's been the last few years that we've gotten a little bit better about understanding, gender variant people at all.
And can we go back to what are the different variants? Because I'm totally fascinated.
As far as how you can identify?
Yeah, and then I want to talk about health needs. Because I'm fascinated by this is a fascinating show. I've waited a long time for this.
So I mean, there are so many different ways to identify. I have, and it can change too. The whole concept of gender affirming medicine, the entire model, is based on on the fact that time is also part of the equation. So time, because it explains why a kid that's 4 can say, I'm a boy, and that, may never change, or it may change throughout their lifetime. And somebody who's 50 might realize at 50 years old, I'm a boy. Gender identity is something that is constantly evolving, and it's based on your culture, it's based on your social experience, it's based on so many different factors. It's much more complicated than like in the 80s when they were looking for a gay gene. They've tried to do that with transgender people as well, and they've noticed different changes on brain scans and MRIs and all this stuff that's just kind of like to find otherness where we really don't need to be looking, because we're really much more similar than different.
Yeah. Fascinating.
Yeah.
So how do all these different identities play into the healthcare thing?
Yeah, I mean, I think with healthcare needs, so my job, so I'm a primary care doctor. I went to med school and residency training, and I got my, I'm board certified in osteopathic family medicine, which means that I do both hands-on osteopathic manipulative treatment, which is a series of, it's understanding that the body can and will repair itself, and fixing certain restrictions in the body, unwinding certain restrictions in the body to get things to move more fluidly, and working on things like back pain and headaches, but also anxiety. And it's so DO schools, MD schools essentially are the same thing, except that in osteopathic schools, the DO schools, Doctor of Osteopathic Medicine, we also learn these hands-on approaches. How that translates into my practice is that I do that most days. I have a very small private clinic and one table, and the table is for both when I see patients for new intakes, but also for the therapy sessions. So I do a lot of hands-on treatment in my practice. I prescribe barely any pain medications. In the 5 years that I've been in practice, I've had maybe 2 patients. So.
Really?
Yeah. And then the other part, so that's the osteopathic part. And then the part where I'm a primary care doctor, when I have LGBT people come to me, it's to set up primary care with somebody who's going to understand that their experience is not the cisgender or heteronormative experience of other patients. And honestly, like I've seen the way other doctors treat patients and the way that intake forms are set up, where all you can choose is male or female or married or single, or you have to put like Mr. or Mrs. It's incredibly exclusionary, and based on those forms, people might decide they don't really want to go get health care there, because they're not being seen. Based on the bathrooms, if you don't allow for everybody's expression, obviously, like, people aren't going to feel welcome to come to you, So my whole goal is to provide as safe a space as I can for people. So that's like goal number 1 with all of this. And then it's understanding it through the context of LGBT care. So knowing that there are certain populations, like those women who are identified as bisexual and lesbian, who don't regularly get pap smears, because it can be more traumatizing, or they don't want to go to a male OB-GYN, or they don't want to go to somebody who's going to constantly ask them if they could be pregnant.
Yeah.
And then, I also have trans men who will get very uncomfortable just talking about their bodies. And I mean, it's the same for really anybody. I mean, I always very much practice body autonomy. I tell my patients, your body is yours, and if any part of this exam feels uncomfortable, we're not going to push on and continue. That's not my job to trigger and traumatize people. So it's having the understanding that...
Well, that's beautiful.
Yeah.
It's not your job to trigger and traumatize people.
Right.
That's so beautiful. I just wanted to let that hang in the air for a second. Oh my God, I almost cried.
It's all about consent, right? And it's all about a person feeling safe being who they are. And I'm so big on that if somebody tells me, you know what, I really would rather not have a chest exam or a breast exam, or however they refer to that specific part of their body, I'm not going to force them through it. I'm going to say, well, this is the recommendation, and these are the risk factors, and this is why it's said to have this done, but I'm not forcing anybody to do any exams they don't necessarily need to be undergoing. And so, like what I was talking about with the PAPs, for a trans masculine patient, it can be an incredibly triggering and traumatizing experience just to have pap smear done, just to have something inserted into what they probably don't even refer to necessarily as anything. I have plenty of patients who just ignore that part of the anatomy completely, and they're so disconnected from it.
Wow.
So it's offering options like, hey, we've got these kits now where you can take this home and do a self swab. Or you're not even comfortable touching that part, that's fine. Come into the office. We'll go very slow. We'll use the smallest possible instrument that we can use for this, and we'll use a ton of lube. We're just going to make this exam as easy as possible. So it's that kind of. And then, part of my job is connecting people to resources. So if I know a surgeon that's really recommended and highly regarded by my community, that's who I'm going to recommend my patients to. And the same with other services.
So what is the age group of the people that you treat?
Everybody.
Do you get kids coming in?
I do, yeah, I do.
What's that like? That's got to be fascinating.
It's awesome, and honestly, I probably have more of what looks like a pediatric office setup than I have pediatric patients, but I just really enjoy giving out stickers and fancy Band-Aids and things like that. So it's for the kids that do come. But
that's amazing.
I have, I do puberty blockers as well. So that's part of the gender affirming treatment.
What's that?
So for those kids who are identified as non-binary or transgender or exploring that, one of the hardest things can be going through puberty. Right? Because if you're identifying as a boy and suddenly you start developing breasts or you start getting periods, that is really traumatizing and hard.
Yeah.
And so when they're right at the starts of puberty, around what we call the Tanner stages of puberty, so between like Tanner 2 and 3, where they just started Tanner. Yeah, that's just the system of staging. So,
okay.
So between like 2 and 3. So when they've had some breast development and maybe a little bit of hair growth, but not a lot else, that's a good time to really go in and start puberty blockers.
And what is that, like shots or
it is
an implant of sorts?
It can be both of those things. The one that I found in my practice that gets most covered is the monthly shot.
Huh.
So essentially what that does is it puts the puberty on hold for a specific period of time, depending on how old the kid is, depending on what the parents agree to as a plan, because this is a family situation. You do need to have the parents on board and involved with this. And so purity blockers are completely reversible. There hasn't been shown to be any long-term harm using them. Granted, we don't have a whole lot of studies and a whole lot of research in the States, but from the studies we have from Amsterdam using these, for over 30 years, there has been very little correlation with any kind of negative side effects.
So what happens? They just have to take their shots for the rest of their life, or they have to come up with a plan? Or?
Yeah, you come up with a plan basically tailored to the family. So say I have a 10-year-old, right? Because puberty is going to be starting around that age anyway. Yeah. So say I have this is a general example that's similar to somebody that I have been treating. So 10-year-old started puberty, is terrified of starting periods.
Yeah.
Is a boy, has been telling this to parents since he was 2 or 3 years old, has no doubt whatsoever. Parents are on board now to do something because they can see that the longer this boy spends in puberty that's not aligned with his body, the more depressed he's getting and the more suicidal he's getting. It's very dangerous to be a kid who feels so much gender dysphoria, as in so much shame and discomfort in their bodies.
Wow.
So if you use blockers, actually with this kid starting at 10 years old, we were able to make it so that he never got periods. He's been able to completely avoid them, and if he continues to do the blockers and then eventually do masculinizing hormones, so testosterone, then he will never get periods.
And so are you kept to be on shots for the rest of your life?
Not necessarily. Yeah, I mean, there are, once you do puberty blockers, the option is either to stop the blockers, or to continue blockers and start hormones, and then you slowly start to taper the blockers down and start tapering the hormones up. So it really depends on the age too and the stage of development. Because like say I get a 16-year-old in my practice, I'm not going to start blockers with them because they've already gone through puberty. There wouldn't be any reason to do that. But we're probably going to start at a lower level of hormones because the goal is honestly to make them look like their peers. So, you know, like say they're in 5th grade, I'm not going to start somebody on testosterone so they have a full beard in 5th grade, right?
Yeah.
So.
Oh, that's fascinating. Wow. So I just want to, I notice your button says they and them.
Yes, yeah.
Let's talk about that for a little bit.
Those are my pronouns. As I told you, I identify as non-binary, and so I'm not aligned with being female or being male. I personally experienced a lot of dysphoria around my name growing up. That's why I legally changed it a while ago, and it's AJ for me is just very gender neutral. If anything, I get mistaken for a male, especially since I'm a doctor, so there's that inherent assumption.
Interesting.
Yeah, it doesn't
Wow,
bother me.
that just says so much right there about our society.
I know, yeah.
Wow.
Yeah.
So they, them.
They, them are my non-binary terms. They're the ones that I'm comfortable with. That's what I align with. So instead of somebody saying she or her to me, about me, or talking about me or talking to me, I ask people to use the pronouns they, them.
So this is a whole thing, though. People have pronouns. So how do you get that language out there so people can get comfortable with it?
Honestly, the way I think we get it out there is to talk about it a lot more openly.
Yeah.
To have every medical clinic have what are your pronouns on their forms.
So what are some of the pronouns that are used?
Yeah, I mean, you've got the standard he, him, she, her. They, them is probably the most common one that I've seen in the millennial and Gen Z generations of what's used for being non-binary or genderqueer or not aligning with one or the other binary. There's also Z and C, and there's a few other ones that people use. Those were used a little more, I think, in the early 90s during the riot girl movements. But there are still people who align with those pronouns too. But most of what I'm seeing is a lot of they, them. And then for instead of Mr. and Mrs., mix, MX. Yeah, which is pretty great. I mean, obviously I use doctor, which that's another reason. That was actually a huge reason for me to get through med school and residency, so nobody would ever call me Miss or Mrs.
Oh my God, that's so fascinating. Yeah. MX. That's fascinating. Now, I'm really sounding and feeling old. Even though, you know, I'm in the communities, I don't know of these things. So how do you get this up to my generation? Look at that. Look at me. I'm in a different generation now. I am an elder.
I'm an elder millennial, if it makes you feel any better. I'm right on that cusp. So.
But in all honesty, because
I mean, I think it's just the way that it's progressing right now. Like, there's more media representation, whether that is good or bad, hard to say. Honestly, I think that any kind of representation that's out there is at least getting people talking and getting people exposed to certain things they might not otherwise ever be exposed to. So even though media and in TV and movies were kind of still viewed through this lens of the other, you know, like those are, you know, those people and they're other and they're just so interesting and different, you know, where we need to be more just incorporated into regular society. I do feel like the wave is, you know, kind of shifting that way. So, I mean, I know some kids that don't necessarily have that whole gender dysphoria around their identities, you know, because they've been affirmed in who they are since they were little, because they've been told, if you identify this way, that's fine. If you identify this way, that's fine. You know, whatever it is, this is your identity and this is your truth. If we just started doing that with everybody, things would be a lot simpler, you know, going forward with all of this. The way we spread it to generations, I mean, I honestly think it's just getting more information out there. Maybe getting more research started. It's hard because the federal government won't support a lot of this research.
Now let's talk about this now, because I remember hearing you say some stuff about insurance and things. Let's talk to me about the medical perspective from this standpoint now.
Yeah. Insurance
what's going
is a
on
big
with that?
pain.
Yeah.
I outsource all my billing because if I had to deal with that, it would be like working my job twice, and I already work 12-hour days. Insurance is really tough, and it's navigating each insurance and knowing the language to use so that they will cover certain procedures. It's basically learning to find loopholes in the system where we can get transgender and gender non-binary healthcare support, because most insurance companies still haven't gotten wise to the idea that this is really important and that we need to be treating everybody equally. As much as that sounds like just common sense, it's not even law everywhere. There's only 18 states out of our in the US that even have built-in protections for LGBT people.
18.
Yeah.
How many are there now? 50?
18 out of 50, yeah. Mm-hmm. So that's really low if you think about it, and that applies to healthcare, it applies to work, it applies to, being fired for being gay, that kind of stuff. So
now you can be fired for just being you, whatever that you is. Wow.
I mean, I can't be fired because I run my own practice
Right,
now,
but
I've been through it.
insurance-wise,
Yeah.
what does that look like? Like, what if you can't find the language? Can somebody not afford this?
Absolutely. So the really good thing is that the next ICD, which is the ICD is the International Classification of Diseases, and it's a coding system that all doctors across the United States use, and maybe the world. I'm not fully sure about that, but basically it's how we are able to code something and then bill it and then have insurance cover it. And same with procedural codes and things like that. So it's this long system, and they're updating it now to the ICD-11, which is not even going to, from what I hear, and this could still change because it's not anywhere in writing
Hasn't
yet.
gone to print yet.
Right. So it'll be gender incongruence instead of gender dysphoria, because the whole thing about labeling gender as gender dysphoria, labeling a variance in gender as gender dysphoria, is that it puts it into the mental health realm. And it makes it so that all trans and non-binary and gender different people are pathologized for their identity. And they're told they have basically a mental disorder. It used to be gender identity disorder. Now they're finally using the language of gender dysphoria, but it's the same thing.
Yeah.
And so what the ICD-11 is going to do is call it gender incongruence.
Incongruence. Wow.
In that situation, it's going to be more of a medical diagnosis than a mental health diagnosis, which is wonderful. What I do now in my clinic to avoid the mental health stigma, which comes anytime you put gender dysphoria in the chart for somebody, is I put it under endocrine disorder. That way I can order hormones.
It kind of is, though.
Exactly. And it's nobody's business beyond that. I do have.
You don't think this is telling the insurance people? You don't think you're tipping them off here, honey?
I mean, if
they're
going to
tighten up the things.
You know what? Maybe they'll actually make some progress in my electronic health record system, because right now, because the only options I have for people are male and female and unknown. I put everybody as unknown. I don't care if they're a cis female, very much aligned with being a female. Everybody's unknown because they're not getting statistics from me based on the binary. I'm just not playing that game.
Good for you.
Yeah.
Right here.
So
you're a rock star.
I'm waiting for all these things I'm waiting for there to be more of a wave of us that do this work so that these things can change, because they need to. 15 years ago, but we're just making the small steps to doing all of that now.
So do you consider yourself to be a pioneer?
I hope so, yeah. I mean, it feels like the Wild West of medicine in a lot of ways.
Talk about that. That's interesting. The Wild West of medicine.
I stay on what I would consider the cutting edge of the research, because I try and go through and have Google alerts for any articles related to sexuality, transgender, non-binary identities, being gay or lesbian. Like I just have all these alerts that send me research articles as they come out. And so I try to stay right on top of it. Any new textbook that comes out that could potentially be useful to me, I get, because I want to know what the latest is. I go to the conferences. So the Health Professionals Advancing Equality, which used to be called the Gay and Lesbian Medical Organization or Association, or GLAMA, they have a conference that they hold every year. So I try to go to that. GLAMA, yeah. I know, it's a great name.
It's fantastic.
But obviously they've outgrown Gay and Lesbian Medical Association, because now it's for anybody who is not necessarily even gender diverse, but allied with that, because we all need to be learning this information. You know? So in that sense, I try to stay on top of all of this. However, the lack of protocols can be disturbing. It can be hard sometimes.
Lack of protocols?
Yeah, there aren't very many people doing puberty blockers, or they're starting them at arbitrary ages. And the thing about the ages is they really are arbitrary. It doesn't make sense to be starting people on blockers at 14 years old, because by then, most children have already gone through puberty or gone through most of it. So if you really want to...
So this blocks the development of...
It blocks the development enough where the hope is that eventually they won't have to necessarily have a lot of the surgeries that other people, in order to feel safe in their affirmed gender, end up having.
Oh, so it changes things from actually growing, as it were.
So if there's been, say you catch somebody between Tanner stages 2 and 3, right when their chest starts to, when they start growing breasts, essentially, they have some breast budding happening. If you start the blockers, you can potentially reverse a lot of that. So that decreases the need for, potentially, the need for top surgery, but also the need for binders. Which,
binders.
If you're transmasculine...
Let's talk about this, binders.
Yeah. So a binder is essentially a garment that you wear that makes it so that you are flat-chested.
Oh.
I have a couple of them. I wear them when I feel more aligned that way. Mostly it feels like a weighted blanket for my dysphoria, if that makes any kind of sense. And that's my experience. I've heard it from some other patients too, but it's not everybody's experience.
I don't think I'd get much help with a binder.
Trust me.
They'd bust out like my ankles bust out on a humid day.
They really do flatten things, though.
It doesn't hurt?
Yeah, it does, and that's the problem. Is if you are getting a starter binder, so to speak, you're going to be getting one that's not necessarily specifically sized for you, and that can cause a lot of issues with crushing the ribs, and not crushing them, just making so there's pain in the ribs and pain in the back. They say don't wear binders for more than 8 hours at a time, but really for most people that's not practical. You're working a 12-hour day. You're not going to be just wearing the binder for 8 hours. And I mean, when we're talking about safety issues, we're talking about transmasculine folk who don't necessarily want to be out there identified as transgender at all. And so they want to be able to, the term for it is pass, they want to be able to be seen as male in larger society, or maybe their work isn't very open, or maybe their friends aren't very open, you know? And so wearing a binder can be a huge thing to feel safe. But medically, you can't wear it for more than 8 hours. There's all these side effects from it if you do wear it constantly, because it squeezes things down, it gives you a flat appearance, and so, there's low back pain, there's rib pain, things like that from it. If you get a specialized binder, they're usually around $100, so they're not really affordable for a lot of the community either.
Wow.
Yeah.
Wow. So if it's not a binder, it's removal?
Not for everybody, and I mean that's the thing. Some people, everybody's gender dysphoria is a different experience, right? So some people don't have it around their chest. A lot of what I see, especially with transmasculine individuals, is that they want to be able to pass in public and not have to explain themselves all the time. So having top surgery is very important because it's the initial presentation. Like, you can see if somebody has breasts, right? And then you're automatically identifying them as female. And so, for example, in my case, I'm not looking to do any surgical interventions, but I don't necessarily like wearing bras, and I very much try to flatten as much as I can, or at least minimize what chest I have, because it makes me uncomfortable to be immediately identified as female-bodied.
Oh, it would be nice just to walk around just wearing a pair of shorts.
Well, exactly, yeah.
Wow, this is amazing. This is absolutely amazing. So you have like 18 minutes left. So
Wow.
I want to make sure we get out all your points. So at
Let me look at my notes.
Yeah,
then.
take a look at your notes, because I want to make sure that we're covering everything. This has certainly been eye-opening to me. I did not know. I thought there was maybe just like a handful of genders, like, you know, like I feel like my gender is a spectrum. You know, it's like I'm happy being a woman. I'm happy. I actually like to call myself a girl. I am a girl. Look at me. I'm cute. But yet, you know, I'm like this thugged out kind of. I'm a train wreck.
No, that's all right. My identity
yeah.
is 80s glam rock. So if somebody tells me, oh, you look like David Bowie, or those Elton John sunglasses are great, it's like you've made my day.
Wait, stop the car. You are a rock star. You can have an identity as an 80s glam rock.
I do.
You know, when I was that's fascinating.
See, check the glitter. I've always got glitter.
Yeah, but
on.
where's the lighter? Where's the lightning? You would look so hot with a lightning bolt on.
I have the
now.
stencils at home. I just
Oh my God! I'm so epic. Wouldn't you like to see a lightning bolt across their face, people? Yeah. You're so epic. Like, who wouldn't want to have you for a doctor? You're
a lot
just
of people,
like,
you know. I mean,
you're just like. I don't know how to say this. You're just like a regular person. You're not like my doctor. You know, you have to have a PCP, and Marion, I got him by default.
Yeah.
And he just wants to give me pills.
right.
And I barely go to him because he's just whatever.
Yeah. Well, I am a PCP, but like you said, the idea is to be approachable, because if I'm going to do a good job providing primary care services, then people need to be able to talk to me.
Yeah, and no pain pills.
No, we don't do that. And we do dog therapy at my mini schnauzer.
Wait, stop it. What?
So it's my office. I opened up AJ Eckert DO LGBTQ healthcare services as a practice last September. So it's been almost a year now that I've had my own business. I've been out of residency training and in practice for 5 years now. My office is very small. I share it with an acupuncturist. I take my table down twice a week so that he can use the same space. We have very low overhead. I use a medical record system, and I have a billing team. But other than that, it's all me and my dog, who is my receptionist.
Stop the car. What?
Yeah, my dog is, he'll be 5 in a couple of weeks. His name is Lupik, which means little wolf. You've met him. He's...
I know. I'm acting like I don't know the dog. What?
He's the
you
best.
got a dog?
He's the best. But he goes out and he greets all my patients. He does the receptionist
Are you like
job.
the coolest doctor on the planet? The
No.
coolest doctor on the planet is on my show, people.
I couldn't be, because the 10-year-olds give me a hard time for not knowing what Fortnite is and other video games. I just never got into video games. So.
Fortnite, you say? That's fascinating. You're fascinating. All right. 14 minutes.
Okay.
What do you want to get out to the people?
I guess I want to just say what kind of services we provide at AJ Eckert Deal, which is now officially called the Glam Center, by the way.
Wait,
I
what?
put in my LLC for that. So
Glam Center.
So
Oh
it
my
stands
God.
for Gender and Life Affirming Medicine. So GLAM. Yeah.
Yo!
I had to trademark it because it's a thing. We might have like David Bowie on our sign or something fun like that.
Oh
so,
my God.
But
Will the inoculations have glitter in them?
it's something we can work on. It safely, yeah. Or I can at least give glitter Band-Aids. But, the goal for the center is going to be to have really a community space where people can come together too, because there isn't a whole lot around here. As somebody that doesn't drink, the option to go out to a bar and meet people is really kind of awkward. I don't necessarily enjoy doing that. Plus, I'm an elder millennial, so I like to be in bed by a certain time, and I work long hours. So I'd rather...
Elder millennial. This is the first time I've heard this phrase. Can we talk about this?
I didn't make it up. It came from...
I've never heard it before.
It means I'm right on the cusp of generations. So... Yeah, so I didn't necessarily grow up all the way with technology. And so I'm 35, so I'm right on that cusp. I think the cutoff is 80 or 82 or something like that for being a millennial. So that's what I'm referring to.
That's fascinating. You're fascinating. You're absolutely fascinating. So the Glam Center.
Yeah, so I really want, and what I've heard from a lot of patients is just like, I want to know more people, and I want to be able to talk to other people with similar experiences and just have like-minded. And it's just this beautiful thing that comes together when I see my patients, where we can actually openly talk and, you're queer, I'm queer, let's have a conversation about this.
Yes.
And it's wonderful. And so I want a space where we can have movie nights and watch LGBTQ or cult movies or whatever people choose.
And it's all generations, right?
Everybody.
An old gal like me could walk through the door and say, how do?
The more, the better. I just want family to be able to have a space where we can all get together. By family, I mean the LGBT community. They've been my family since I was in my late teens and incredibly
You're an angel.
dysphoric.
That's what you are. You're an angel, aren't you? You
and so
are an angel.
I'd like to have movie nights. I want to have a program where we can have people who've had top surgery bring in their binders and trade them. So like a binder recycling program, so that it can be more affordable or free essentially. I want to have clothing swaps, because once you're on hormones for a year or 2 years, your body changes. You can no longer wear the clothes you're wearing. You probably don't even want to be wearing the same clothes. So have clothing swaps regularly. I want to have drop-in meetings for people who just want to come in and hang out, play board games, do whatever, just talk, have coffee. I'd like to have, a community garden that people can... There's a lot of plans I have, and so I'm trying to save to be able to just open a space in Old Weathersfield where we can do all this, including the healthcare part of it. So what other programs? There were, I'd like to really get involved with also fostering, because LGBT youth is a big part of the homeless population. So It would be just great to have a space where everybody feels comfortable and safe and free to be who they are. That's honestly the bottom line of all of this.
Wow. Is there anything you want to speak to about legislation or any this activist type stuff?
Yeah, I'm on the board of PFLAG Hartford now, which is awesome. So I'm their community health outreach coordinator.
Wow.
I'm also the Connecticut representative for OutCare Health, which is an online source that's trying to put together all the health professionals who are actually LGBTQ competent, not just friendly, but competent.
LGBTQ competent.
Yeah. So it's a step above friendly.
Wow.
It's understanding and knowing how to approach certain issues in certain populations. And then in my clinic, I do I do primary care, I do preventative health, we do physicals, we do customized gender affirming treatment, puberty blockers, and then screening and testing for STIs and HIV, PrEP and PEP, which...
What? What?
Pre-exposure prophylaxis and post-exposure prophylaxis. So if you are at a medium to high risk for contracting HIV, depending on who your partners are, or if you have multiple partners, there's a bunch, or if you're having sex with an IV drug user or something like that, right? Or if you're monogamous and your partner has HIV, it is a treatment that reduces the risk to less than 1% of contracting.
Wow.
Yeah. And so that's definitely an initiative that we're trying to get more people involved in too. And then I do the osteopathic, the hands-on care too.
You do it all. And then some.
I mean, it's honestly my dharma. It's what I'm here to do on this planet. So I try to keep that in mind as I go through every day, because they are long, hard days, but I do it because I really, truly love the work. And so I'm really hoping to have this clinic be something that blossoms into something beautiful, and that's around for a while.
Oh, it's a beautiful idea. Are you the only one doing this? I don't know of anybody else doing this, like, on the planet.
Yeah, well, there are definitely gender clinics and centers and things like that. So
yeah, but
I
like
would never take
a
credit
regular
for that.
doctor, hi, how are you? This is something different.
I mean, I think it's in the scope of every primary care doctor to be able to provide gender affirming treatment and care for the LGBT populations. We're not there yet, but part of my mission is to say, like, listen, I'm a family doctor. I did extra work in the LGBT research system because this is what I'm here to do. But that's accessible to everybody. Medical schools need to start incorporating a lot more hours of education around LGBT health.
Wow.
Residency programs. We need to have continuing medical education that involves, everything around the scope.
And you're just not the doctor, you're in part of the process yourself.
Right.
Which is an amazing thing. I think that's what makes you rather unique. Because you get it, because you're in it with me type thing.
Yeah.
And I bet you your patients really enjoy that.
And, it's
like an instant bond.
And it's so awesome, honestly. Like, I can't even think of a better word for it. It's so amazing that this is the work I get to do, because growing up, I had terrible experiences with healthcare. Being in med school, I was told, oh, you got to tone down your resume. If you come off as too gay, no program's going to want to hire you. Coming out into practice, I thought, oh, geez, well, I'm just going to have to conform and do these things. And having the chance to be able to open up this practice and have it grow the way it has is just the most beautiful thing that has happened to me in my life. And so being able to do this work and have patients that mirror my experience in some ways, that I can say, hey, when I was younger, I was going through a similar thing, and now I can provide them resources. That to me is just, it's beautiful. I love that, because this community, this family has been there for me when I was a kid and I was going through, all the stuff that I had to go through with my gender dysphoria.
And now you can be a beacon of hope to anyone.
And I want to also align with other LGBTQ businesses. I want to have a resource guide so that people can come to Connecticut and be like, okay, this is the place I can go. And they don't have to feel like they're navigating their own healthcare in these like underground railroads of word of mouth, which is what it is right now. So I want to have the center have therapy and art therapy, and I don't necessarily want to be in charge of anybody else, but I want to be able to support other LGBT businesses. So.
Oh my God, you are just, and to think I know you.
Listen, these are all dreams, so it's all still in the process.
Yeah, but listen, it's clearly happening. It's clearly happening, and my God, I can see it all happening. You've got the wherewithal. Do you have like patients coming from other states just for you?
I have a few, yeah. But my other goal obviously is to find them resources closer. I don't want this to be something where people have to travel far and wait for a long time. I don't have that kind of gatekeeping role with my patients. So I want them to be able to find the resources wherever they are, in their state. So it's just building this kind of connection between different groups and being able to just have everything out in the open so people feel like affirmed and safe to go to places like my clinic.
Wow. And there's other doctors like you out there in the world?
They have to be. There are some people doing the research, so I believe that there are, yes.
Wow. It's just amazing. It's just amazing. So when you went to med school, well, we got a minute or two here. What sent you down the path to become a doctor in the first place?
Yeah, so that's...
Because it's clearly like you were born for this. What was the road to becoming a doctor like?
I actually started as an archaeology and music major. And I told myself I would never take science again in my life when I started
Archaeology
college.
and music? You're gonna find old instruments and play them?
No, it's a double major. I was always ambitious, but that would be cool too. And I got into forensic science through archaeology, and then I became a forensic science major. And then I was like,
you decided you want to work on the live bodies?
Yeah. The short of it is that, because I didn't want to spend my days in a lab, and so I thought, okay, I got to go to med school, and so I ended up going to med school thinking I'd be a medical examiner, and I found out, hey, I actually know how to talk to people, and I could maybe potentially do this. And I've always been very politically and socially involved in LGBT care, so that's just something that evolved with me, even though I never in my wildest dreams imagined that I'd be able to have the kind of practice that I have now, because there was nobody in med school or residency that would be affirming me in that way. If anything, they were like, let's not talk about this stuff at all.
Yeah.
So, somehow I managed to make it to where I am now.
Yeah, and how did you get from where residency to this shining beacon of hope, this angel on the planet to help all?
Honestly, it came down to two options. I was either going to quit medicine and stop being a doctor, or I was going to open my own practice. And I took the leap into the fear and the unknown and opened my own practice. And so far, knock on wood, so good. I spent the first couple of years out of residency incredibly depressed. I was suicidal. I actually spent a week in Middlesex IOL.
Really?
Yeah, I had a really tough start, and it was a hard time. It was really tough because I honestly felt like I didn't have a place to belong. I didn't feel like I was getting any respect as a female-bodied person out in the world who's a doctor. My tattoos, my colored hair, just didn't give off the impression. And I would hear it all the time. Oh, you don't look like a traditional doctor. I take that as a compliment.
I'm sitting here and I think, well, you don't want to be a traditional doctor. You've broken the mold. So it sounds like there wasn't the kind of doctor you wanted to be, so you just became you, and becoming you became the doctor that you are.
Yeah, exactly. I couldn't have put it better. And I love that, yeah.
Oh, what a gift to the planet you are. Absolutely. This individual right here, they are a gift to the planet. Did I get it right? I did good?
You did good.
You are a gift to the planet, and I am in such admiration of you. And I literally feel like the world is a better place because you are here doing what you're doing. And it is true. When being you being you, is changing the world.
Well, and me being me is putting me in a more genuine place where I can talk to my patients and they see me and I see them. And that's really what it's about. It makes me so uncomfortable to have this be a focus on me.
Yeah.
I'm one step in the process of making this, what I hope becomes a better and more tolerant world.
Oh, and I can't think of a better place to stop. Thank you for watching. We'll see you next time for another episode of Time for Healing.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.